Dr. Benson, you had referenced before a step down or a different level. Do you have a proposal in that regard, or have you made a proposal before, that sort of thing? Because as far as financially is concerned, that might be one methodology that we could use to maybe enable us to not have to increase funding to such a high degree. So have you had a proposal before? Might you have one now that you might be able to offer to us?
We have certainly had lots of internal discussion. We will continue to discuss some options around some thoughts and ideas that we have with the incoming administration. Our commissioner just started last week. We will be meeting with her this week, and we will continue to flesh out some of those thoughts and ideas about what could we do differently that might make some sense to manage this population a little bit more efficiently, or at least the growth of this population. There are a total of 20 programs around the country, and they all do them a little bit differently, but we've also done our due diligence with respect to what seems to work in some other jurisdictions and what could work here. But as we sit here today, we're not prepared to offer any options. We do understand the sense of urgency around this issue, and also the need to balance controlling that growth with the public safety components. We have done some things in the past around sentencing policy, keeping some sex offenders in prison a little bit longer at that lower rate, as opposed to letting them out and letting the courts decide whether or not they meet the civil commitment criteria. There may be some things we can do around that, but I think there are also some things we can do around our program, around the referral process, the courts process